Welcome back. Have you ever had this experience? Let's say you have high blood pressure or really any medical condition. You get put on a medication that the doctor says, let's try this, and this works for a lot of people. Let's try this and see if it works. And then it may work a little or it's not so great. So then but you have to be on it for a few weeks to see if it's going to work for you. Well, if it's not that great or the doctor isn't as pleased with the results as they'd like, they switch to another medication. They say, well, let's see if this one works better for you. And on the cycle goes. It could take months. It could take lots of money. It could also take your condition deteriorating for a little bit. And that's not good for anybody. But there is a new genetic test that's going to be tested at Fairview that may let you skip right to the meds that are perfect for you. Here to chat with us about the study is Dr. Don Tran. He is the Vice President of Medical Practice for the Fairview Medical Group and the principal investigator for the study. Dr. Tran, I'm so happy that you're on the show with me tonight.
Hello. Hi.
So did I characterize that correctly? Is that what the study is going to do?
I think you did a great job. No, I think, in general, I think we've have pretty good science that helps guide our treatment of high blood pressure.
Sure.
And so the studies have been done, over many years and have studied many patients. And so, they do generally give us a pretty good sense of how to approach the treatment of patients with high blood pressure. And I think from time to time, those guidelines change. Mm-hmm. And yet the science underlying all of that is, fairly based on fairly large populations of patients. And then from those outcomes, we then have to figure out, what's best for an individual that we're trying to treat. And so I think this study is particularly interesting and exciting for us because it allows us to think about how to personalize that approach and to use, genetic testing, which is kind of coming into its own in terms of how to best find a better medication for a patient. And I think the way we're approaching it is very rigorous, and that is, it's a scientific study like any other rigorous study that hopefully will add to the body of evidence that will help, guide your doctors to kind of figure out, what's the right medication, perhaps, to choose the right medication, right off the bat instead of kind of more of a trial and error process.
I want to talk about the study methodology in just a moment, but people probably don't realize that high blood pressure impacts 1 in 3 Americans. That is a whole lot of people. That is 33% of all American adults. It's called the silent killer, hypertension, the silent killer. It costs America about $46 billion every year. $46 billion every year. And high blood pressure also kills about 1,000 Americans every day due to the fact that it leads to heart disease and heart attacks. So, Doc, talk to me about what is the methodology right now that you use to put people on high blood pressure medication?
Sure. I think you hit on some of the key things that make this condition so important for us to kind of find the right way to treat. I think currently what Minnesota has a great healthcare system, and therefore we do a very, very good job of controlling high blood pressure. Most of us use the most recent guidelines, and those guidelines are probably 3 years old now, but it's a joint commission that have been putting out guidelines for, many years. The most recent guidelines are the JNC 8 guidelines, which essentially, looked at the data again and gave us a lot of good flexibility, and that is it tells us that you're a new patient with high blood pressure and you're under the age of 60, you can choose from, one of 4 classes of medications. And then based on how you respond to the first medication, they give us guidance on kind of how to go on to the next step and then to the next step. Interestingly, there are very few good studies out there that tell us exactly what medication to start with right off the bat, and very few head-to-head studies that tell us, exactly how to increase the dose, what medications to add next.
So how is this study going to be different? What is this study going to change?
Well, I think this is, the unique thing about this is that I think we will, after we diagnose the patient with high blood pressure, take a sample with a very simple swab of your cheeks and get some DNA sample. And that sample will be sent to a genetics lab that'll run a pretty sophisticated testing to kind of see genetically what should be the right medication for you. I think that's really the fundamental new thing that we're trying to do here, and essentially to use your genetic information to guide your treatment versus kind of large populations of patients, guiding the treatment of an individual.
So you're going to match up the genetics with the medication that worked the best for the people in the study, right?
I think that's the hope, and that's what we're trying to show. And so I think we clearly, the test is designed to kind of give us, the clinician, a recommendation that to choose a medication based on that genetic profile of that particular patient. So that will be exactly what we're trying to do, and we'll compare folks who get that kind of testing, guided kind of therapy, versus folks who get the usual care, and then we will see, which group gets to target blood pressure goals faster and with the least number of medications.
And then eventually, I guess, after the study is complete, you're then hoping to use the results. So then when I come to you and you diagnose me with high blood pressure, you can take a cheek swab and you could say, oh, okay, well, your genetics match up to those of the people that had this medication. So you put me on the proper medication from day one, right? That's the ultimate goal.
That is the ultimate goal. I think, at Fairview, I think we're pretty big into, finding the latest innovative ways to treat you well, and really finding the way to treat you well with kind of the least, number of medications and the least amount of side effects. And so hopefully by picking the right medication right off the bat, we'll minimize the side effects that you will, you may develop, and certainly, lessen your exposure to more medications. Unfortunately, this is a medicine that over time, most patients need to be on multiple medicines. And so some of that could be driven by the fact that we aren't picking the right medication right off the bat.
So this is about an 800-person study. Are you still looking for people to sign up for the study at Fairview?
Well, I think what we are doing now is the way the study is designed, it's really just to enroll, Fairview patients. And so we are targeting patients that develop hypertension or already have high blood pressure at, one of our 8 larger clinics. And so it's at this point going to enroll only Fairview patients at those sites. And it'll probably continue over the next, 6 months or so as we try to enroll up to 800 patients in the 2 arms that we're looking for.
When can we see some results?
Probably the first set of the results will start to roll in about 3 to 6 months or so after, we start getting on some patients into the studies. And so there's a bit of time to, get the study, the cheek swab results as well as kind of the results back. And so probably 3 to 6 months, we will begin to see some initial results.
Well, gosh, I'm so glad that Fairview is embarking on this. I think it's terrific that we do this here in our community. It could help our folks living here even faster. Dr. Don Tran, he is the Vice President of Medical Practice at Fairview Medical Group and the Principal Investigator for the study. Dr. Tran, I wish you the best of luck, and I hope maybe in a year you'll come back and share the results with us.
I'd be happy to. That'd be great.
Wonderful. Have a great night. Thank you, sir.
All right. Take care.